Hi, Washington Church. It's Aaron Yoakam. I'm a member at Washington. I've been going there since 2005, and I'm also a local healthcare provider. So, Pastor Jimmy asked me how I feel about returning to church for in person services. And my initial response was that I'm hopeful. I think that as a church, we need community and we need socialization and we need togetherness. So I think that it's great and I'm excited, but at the same time, I think it's important that we understand why all this happened. And I know that this pandemic has been hard and it's interrupted our lives, but I think it's important that we all know that SARS-CoV-2 coronavirus is a real thing, and it's can be a very dangerous thing. I know it's hard to buy in to all of this social distancing and all the interruptions to our lives if it hasn't been personal to you. And there's probably a lot of us here that don't know anybody that had coronavirus or know anybody that died from coronavirus. But just being in the hospital, I've seen a lot of it. A quarter of my office got coronavirus and were very sick. And so this is a real thing, and it can be very dangerous. Just here in Lucas County, we've had 2,500 cases, and 250 people have died. And so there's still new cases every single day. I think it's also important to know, though, that most of us are not at major risk from coronavirus. Most of us who are under 45 years of age have very little risk, especially if we're healthy without a lot of other medical conditions. But I think it's important that we do know our risk. So those of us that are high-risk individuals, maybe advanced age, if you're over 65 years of age, or more specifically over 80 years of age, this virus can be really hard on you. Even if you are healthy, when you have an advanced age, it can be tough. And also anybody with pre-existing cardiac or pulmonary conditions, COPD, asthma, coronary disease, hypertension, that can also increase your risk. I just think it's important that we know our risks so that we can personalize a plan for us of how we can attend church. So does that mean that you need to attend church in person? You can join us in the lawn, in your car, so you can come to the building, or should you stay home and just do it online? It's just important that you make that plan for you. For me and for my family personally, as a member of Washington Church and a healthcare provider, but also a father of a son who is high risk, it's hard for me to make that decision because he is high risk, but at the same time, I think that we can mitigate his risk and still attend church. So our plan is to come and join everybody else on the lawn. We're going to do our best to mitigate that risk, and I think that if we all do that, then we can come together safely. So just a few quick points on how we can do that. Masking. I think masking is important. I think that it's been proven to work, and it can make it a safer place for all of us to come together. 2 is hand washing. Wash your hands, wash your hands, wash your hands. There's going to be hand sanitizer available for everybody, and so we should all just focus on that, especially even with our kids. Just really focus on hand washing. Next is social distancing. Try to be in your pack. We're all going to come together and we can see each other, and that's exciting, but stay with your family unit and continue that social distancing. And 4, hugs and handshaking, they're great, and I think it's been one of my favorite parts of church growing up, but it's not something that we can do now. And I think that it's important to know that a smile and a wave is okay. So I'm excited to come together, and I plan to come to church, and I think it's going to be safe if we do the things that we can do to mitigate risk. So I'm excited to see you all, and I think that we can do this safely. So thank you.